no matter where you get your news from, whether it's from the mainstream media, or if you watch alternative media sources, or you read a daily blog, or you subscribe to an actual paper, or you listen to talk radio, no matter where you get your news from, I think we can all agree in this room and across the nation that in order for anyone to formulate an intelligent opinion on any proposed legislation, the first thing you have to do is read the bill. There are currently, as of today, there are 8 healthcare reform proposals being discussed in Washington, D.C. 8. 6 of those 8 call for a public insurance option, a public plan option. Well, what's a public plan option? It's a government-run healthcare system. 6 of the 8 proposals call for that government-run healthcare system. Those same 6 proposals call for an immediate expansion of the eligibility thresholds for the entitlement programs we already have, Medicare and Medicaid, meaning that more Americans will qualify for those programs. Take that data and consider the fact that Alex mentioned 56% of all healthcare spending in the United States is attributable to the federal government through the Federal Employee Health Benefits Program, which we heard a lot about during the campaign. Medicare, Medicaid, TRICARE, Veterans Administration makes up 56% of all healthcare spending in the United States. All healthcare spending in the United States makes up 16% of our entire economy. It's a huge slice of pie. Can you imagine what kind of power grab that would be to get control of that portion of our economy? The American Recovery and Reinvestment Act of 2009, otherwise known as stimulus package. We all know that, right? It's law now. We know that, right? Has anyone finished reading the bill yet? I did read 2 portions. I read a portion about COBRA. Obviously, being the insurance guy, wanted to know a little bit about that. And I read the portion about comparative effectiveness research. In the stimulus package, Congress has injected this language and funding for comparative effectiveness research. Does anyone know what that is? No. It's a government license to ration healthcare. Look it up. Comparative effectiveness research. We blogged about it. You take a license to ration healthcare and you combine that with a power grab for 16% of our economy, otherwise known as our healthcare spending, and there's only one path. And that path leads to a single-payer, universal healthcare system, much like the one in Canada.